Yes, ma'am. We can start, ma'am.
We are a country of various religions, customs, languages, and culture. Let us celebrate Indian Independence Day by coming together, uniting against all the odds as one big country. Carried with care, coated with pride, dipped in love, flying in glory, moments of freedom in shades of joy. A happy Independence Day to all. I'm delighted to welcome all our dignitaries, guests, doctor, parents, and well-wishers on behalf of AYUR NANDAN team. Children, they are not only innocent and curious, but also optimistic, joyful, and essentially happy. They are, in short, everything adults wish they could be. They are the highlights of today's topic. Faith and prayer, both are invisible, but they make impossible things possible. I request Akshaya to lead the prayer.
महागणपति गजानन महागणपति गजानन उमा महेश्वर प्रियनंदना महेश्वर प्रियनंदना महागणपति गजानन गणनायक वंदित चरणा गणनायक वंदित चरणा तव चरणं भव भयहरणा तव चरणं भव भयहरणा तव चरणं भव भयहरणा महेश्वर प्रियनंदना महागणपति नमामि धन्वन्तरिम् आदिदेवम् सुरासुरैः वन्दित पादपद्मम् लोके जरारुभय मृत्युनाशम् दादारवीशं विविधौषधीना
Thank you, Akshaya. A teacher is a compass that activates the magnets of curiosity, knowledge, and wisdom in the pupil. Teaching is a noble profession that shapes the character, caliber, and future of an individual. I would like to call our principal, Dr. Kritika, to start the day with the words of her wisdom.
Thank you, Tejashree, for a wonderful introduction, a prayer by Akshaya, and thank you to Rakashweta. Namaste to one and all present in the webinar, and a happy Independence Day wishes to all my dear teaching faculties and my dear students and our dear guest speaker, parents, and all the others who are present in this webinar. On behalf of Nandha Education Institution and Nandha Ayurveda College, I am very happy to welcome you all, and a special thanks to our guest speaker, because on this day, even though it is Sunday, she has accepted to be our guest speaker. And I heard from Dr. Amal that she is a successful practitioner in Kaumarabhrithya. And really, ma'am, we thank for giving your wonderful and valuable time for our student community. Thank you. And on this day, I request all my dear students to develop an individual social responsibility, which is the need of the hour. And in this day, we take a pledge, we unite together to win the fight against the COVID. So how we got freedom on August 14th from the Britishers, like that, we have to get freedom from this deadly communicable virus, this COVID-19, and we should unite together for the forthcoming any difficulties which we are facing in our country. Not only the disease, any other difficulties in the border or whatever it may be, as a student and as a individual in this nation, we should have the social responsibility, and let us take the pledge on this day, and we have to save our country. It is there in each and every one of our mind. And I wish once again a happy Independence Day, and all the best. Thank you.
Thank you, ma'am. Creativity is the key to success in future, and education is where teacher can bring creativity in children at that level. I would like to call Dr. Navya, Assistant Professor, Department of Kaumarabhrithya, Nandha Ayurveda College, to introduce our guest speaker.
Good afternoon and happy Independence Day to one and all. It's my pleasure to introduce today's guest speaker, Dr. Reena Kulkarni, ma'am. To begin with, ma'am had completed her UG studies from Sri Kalabhairaveswara Ayurveda Medical College, Hospital and Research Center, Bangalore, and PG studies from Government Ayurveda College, Trivandrum. And ma'am is a PhD holder from NIA Jaipur and completed MHSC in Clinical Child Development from CDC Medical College, Trivandrum. And ma'am is accredited to DASI tester KM Hospital, Pune, Maharashtra. And ma'am is also accredited to Marma practitioner for Tirumular Ophthalmology Institute, Coimbatore. Ma'am is having teaching experience of 14 years, including UG and PG, and published more than 45 research papers, including international and international journals. And ma'am is contributing author of 2 books in Kaumarabhrithya, and participated in many seminars and workshops as a subject expert and a delegate. And ma'am is a member of research team on Swarnamrita Prasana. And ma'am is a recognized PhD and PG guide and guided 9 PG research works till now. And ma'am was awarded as with a cash assistance from Department of Science and Technology from Government of Kerala for her PG research work. And ma'am is awarded as Best Doctor for continuous 4 years from 2013 to 2016 by SDM College. And ma'am also received Kaumarabhrithya Award from Association of Ayurvedic Professionals of North America in the year 2019. Currently, ma'am is working as Professor and Head of Department of Kaumarabhrithya, SDM Institute of Ayurveda and Hospital, Bangalore. A warm welcome to you, ma'am, for this section. Over to you, ma'am.
Thank you for that warm welcome. First of all, greetings to everyone on the occasion of Independence Day. Then very happy, and it's my pleasure to accept this particular event and to be sharing some of my experiences with all of you. And for this, I would like to thank and express my gratitude to the Nandha Education Institute, the principal madam, the whole of the Kaumarabhrithya team there, Dr. Nandha, and especially Dr. Ramal for giving me this opportunity. And let us not waste much of the time here, and let us straight away get into the talk. Can I share the screen now?
Yes, ma'am.
Yeah. Is it visible?
Yes, ma'am.
Is screen? Yeah. I hope my voice is clear.
Yes, ma'am.
Yes. And dear students, and I think there are many practitioners as well as faculty members. Once again, I say good afternoon to everyone. And I would like to draw your attention regarding the topic of today's discussion, that is management of common respiratory illnesses in children. Now, why this topic? It is again a very, very important question. We all know that children are very important play important role in the family. They are actually pivotal of the family. And a child is disturbed means the whole family is disturbed. A child is happy means the whole family is bubbling. That is the importance of a child in a family. And imagine if a child falls sick, and especially if the child falls sick repeatedly, that has a greater impact on the family. Now we all know that Balo Sleshma Vastayam. That means children are predominantly Sleshma Pradhana in nature. Balye Vivardhate Sleshma. So Sleshma is considered as the substratum which is required for the development and growth of a child, because we know that majority of the dhatus in the human body are Sleshma Pradhana in nature. And since the child is in the dynamic phase of growth and development, the Sleshma forms the substratum for it. Hence, the child is called as Balo Sleshma Vastayam. At the same time, it also, since it is in the Vardhana Vasta, it also refers that the child is in the period of immaturity, because we know that Paripurna Dhatu Avastha is attained only by the age of 30 years. From 16 to 30 years, it is the Paripurna Dhatu Avastha, that is Vivardhamana Dhatu Avastha. And as the child approaches around 30 years, as per Charaka, he becomes a Paripurna Dhatu Avastha. So the child now, when we speak of Kaumarabhrithya, we deal more so up to the age of 16 years, that is in the Aparipakva Dhatu Avastha of a child. And hence we are dealing with a more and more immature child in our regular practices. Now we also know that the child is in the Kshira Annada Avastha or in the Kshirada Avastha. What happens is Prayena Ahara Samskarat Bhavati Aniyato Vannihi. The child is having poor Agni also. Now this is again one of the very important factor to be remembered, because most of the diseases which occur in the body are because of the initial vitiation of Agni. So we need to have a eye always on the child's Agni before we manage the child's conditions. Now moving on to the respiratory illnesses are the most prevalent illnesses in children. The reason being multiple. And we also know that malnutrition remains to be most important comorbidity in these children. As we know, we just discussed that the Agni is having a varying avasthas in the child. So because of that, child is prone for repeated illnesses, that to kapha pradhana illnesses, amashayutta diseases more. And because of this, the child is even prone to develop malnutrition. Moreover, when we come to the respiratory system as such, the respiratory system is having a very low volume in child, and there is a lot of lag with regards to the terminal bronchioles, because they are still at the stage of development, Then poor lung capacity and compliance. We know that because of the lesser lung volume, lesser lung capacity is there in the child, and so also lung compliance. Lung compliance means it's a ability to undergo or face the adverse events and to recoil back, come back to its normalcy. In other words, the lung defense mechanisms, the innate lung defense mechanisms are at a lower status. Then increased intraluminal glucose production is higher in children. That is because any ascending infections in the child. Then coming to reduced immunological barriers in the child. We know that our respiratory system is having a typical mucous membrane. It has the immunoglobulin A, it has the ciliary barriers, it has the mucosal associated lymphoid tissue. All these aid in prevention of multiple infection to the lungs. But all these barriers are not yet completely developed in a child, because over the 8 years all these things will develop, and child may not be all may not be above the age of 8 years, so they are they're prone to develop a lot of lung infections or respiratory illnesses in the early period. Now there's one more peculiarity, we call it a short and straight left principal bronchus. Now this left principal bronchus right away from trachea enters into the lung parenchyma, and if at all any infections are there, they are carried directly into the lungs, and the lung parenchyma can be infected in children. Now, possibility of congenital anomalies you cannot rule out, because a child can have respiratory congenital anomalies. Now, initially the child can have the tracheal smooth muscle weakness, okay, that presents as a stridor initially. Later, the child can have something like that, bronchopulmonary dysplasias, if at all the child needs to be cared in the NICU in the initial stage of life. So also any space occupying lesions of the lungs, as well as any probability of dermal sinuses in the chest that can directly connect with that of the lungs or respiratory system could complicate the infections. At the same time, the very close associate of respiratory system, that is, cardiovascular system, children may be born with some of the congenital anomalies like, ASD, VSD, the congenital cardiac anomalies. They also predispose the child for recurrent respiratory illnesses. Now, with all this, idea in our mind, we only know that respiratory area as compared to the whole surface area of the body of a baby, respiratory area is the one which is largest, which is exposed to the external environment, and it has all possible connections to carry the ascending infection into the respiratory system. So this makes a child more vulnerable to develop respiratory illnesses. Now let us see what all the respiratory illnesses which we come across commonly. Now this is again very important one. Just look into this slide. Interestingly, you have the yesteryear captain of Indian cricket team, MS Dhoni here, and a child, a happy, malnourished child in the picture. Now, why this comparison? We know that MS Dhoni represents a more composed, steady, ideal captain of Indian cricket team who took the Indian cricket to a greater success in the last few years. And he is called as man of perfection and a composed personality. Now, exactly you look into a child who is immature, who is not at all composed, who is prone for various diversions, and who is more prone for the disease. Tatra balam aparipakva dhatu, ajata venjanam. It is not developed completely, and he is saukumarya, and because of alpakaya, it's not fully developed. That's why he is not even eating all kinds of food. That makes him more weaker and more prone for diseases. Now, let us see the contents of this presentation. We'll be dealing with some of the common respiratory illnesses in children, like Pratishaya, Tundikeri, Kasa, Shwasa. Because, when we sit in OPD, if we have 100 patients per day, we see around 40 to 50 children only of respiratory complaints. And that makes it very important to know about respiratory complaints in children and its OPD management, and to some extent even IPD management also. Then, of course, pediatric COVID, now it is a hot cake. Nowadays, everybody is worried of this one, and the impending third wave is more dangerous. That is what the statistics says, and hence everybody is worried. So we'll see a few aspects of COVID, pediatric COVID also. Now let us take up disease one by one. First one is Pratishyaya. I've put a lot of things in this slide, but I'll be highlighting only important things which is useful for clinical identification of a condition and how to manage these conditions. Let us not go not much deep into the pathological aspects of this for the today's lecture. Now we know that Pratishyaya, everyone knows. Who has not suffered from runny nose? Who has not suffered from nose block? And the person, when he is having a runny nose or a nose block, he knows a simple disease with a lot of irritation, with a multiple complications. Now, which is very frequently seen in children, and why this is frequently seen, we have already discussed. Now, this particular condition is majoritarily grouped into Vata, Pitta, Kapha as per our understanding. And this classification is more so based upon the clinical features. Whenever a child is associated with, dryness in the mouth, recurrent nose block, and pain in Shankar, Shira Pradeshas, and a watery discharge, you call it as Vataja Pratisya. When a child has a mild degree of fever and there is a burning sensation inside the nose, and there may be, indurations in the tip of the nose following recurrent rubbing, and there is somewhat a medium thick, somewhat yellowish discharge from the nose. Now, Kaphaja, where the child can present with somewhat mucopurulent kind of discharge, it's a heavy discharge, it could be yellowish tinged, deep white, thick discharge, sometimes associated with the itching inside the nose. So, knowing why we should know this, always the treatment principles in child is mostly doshopakrama rather than Vadi Pratinika. The reason is, again, children are to be given with very mrudu aushadas because of their innate immaturity. So dosha assessment is more important than the disease pathological conditions initially. And this can happen in a Kshirapavastha, Kshiranadavastha or Anadavastha. Now management, based upon the dosha, you can select some of the clinical, time-tested clinical prescriptions I would be dealing with today. Something like, Tulasi Rasa, single drug, 1 to 2 ml twice or thrice daily with honey in case of Vataja Pratishyaya. Similarly, Pitta, where there is association of the Jwara, Parnayavani, same dose with honey or little bit of, Udipanapachana medications. Like, simple, a pinch of Ashtachurna or Trikadu you can definitely use. Next, you have Sleshmaja, where, Ardrika Swarasa with honey. Okay. Now, we have certain rasaushadhas which we regularly use in the clinical practice, like Mahalakshmi Vilas Rasa or Naradiya Lakshmi Vilas Rasa, Vettumaran Gulika, Vilvadi Gulika, Dashamula Katutraya Kashaya, Amrutottara Kashaya. Remember these few medications. That's good enough to practice. Then you have certain proprietary medicines like Trishul, Afluvasil, Tulasi Kantakari, okay, or Shwasamrutam. So some of these medications which we can have a handful prescriptions. Now, what is very important is steam inhalation. You can use a plain steam inhalation, or you can put 1 or 2 tulsi leaves and give inhalations, or you have some of the prescriptions like, the Helen or Pranadhara drops, in a very little quantity we use them. Now, what is more important than these oral medications is that some of the external and local therapies. Now, we commonly use this Nagadali or Tulasadi Kera with Rasna Churna, or Nirgundi Eranda with Kachuradi Churna as a talam, or simple Vacha Churna or Haridra Churna, just make it a warm, and either you can mix it with Tulasi Kera or just put it on the scalp. After the initial control, Grutapana, like, sneham ante balayacha. To improve the respiratory integrity, we can use some of the medicated ghees like Indukantagruta, Haridrakhanda, like this Vidaryadhigruta, these medications to improve the immunity of a child. As we know that this Pratishaya, Kasa, Shwasa, without the involvement of Agni and Pratilomagati of Vayu, don't have these diseases. So ultimately, Anuloma Chikitsa is very important. So sometimes we use Haritaki or Agastya Rasayana, Chitraka Haritaki Rasayana in these conditions. Now, Indukanta Kashaya and Rajanyadi Churna, we have documented a lot of immunological benefit with the combination of these two drugs, which we frequently practice in the clinics. Now, I'll be dealing with some of the scenarios little later. So it's just a background information which I'm giving to you. Now, moving into the next, we move on to the Kasa. Now, Kasa. What is Kasa? We know that cough is a reflex. In fact, it is a protective reflex. So when the ascending infection is beyond the protective reflex, this particular condition turns into be a disease status. So it is a very common manifestation both in upper as well as lower respiratory tract conditions. And if the Kasa is persistent, coming in bouts like a paroxysm, so that indicates that lower respiratory tract is involved, and it may be associated with a fever. Now, when the Kasa presents with a high-grade fever, with the bouts of cough or absence of cough in a child, both could be indicative of a little more severe status of a Kasa, where the child would have had the infection spreading onto the lung parenchyma itself. So that could present like, pneumonitis or pneumonia-like conditions in a child. Now, innate immaturity as well as the anatomical peculiarities makes these things spread faster for the child beyond the protective reflex. And we all know that we have classified Kasa into 5 types: Vata, Pitta, Kapha, Kshaya, and Kshataja, most so based upon their clinical features and the etiological basis. Now, a child could be having cough as a result of Kshata in the initial life. That is, nowadays, more and more sophisticated neonatal care children are being cared in the NICU. They might develop a lung damage, and that can present in the later childhood as recurrent cold, cough, and breathing difficulty. So Kshataja Kasa also comes into picture. Then mostly these 5 types, when we discuss classically, they may be indicative of progressive severity of a condition. Vataja Kasa, comparatively only upper respiratory involvement. Pittaja, so lower respiratory up to the level of the trachea, along with the inflammatory changes. Then Kaphaja Kasa, when the bronchioles are involved. So then Kaphaja Kasa, then it can present with the spasm, bronchospasm, bronchitis kind of presentations. And finally, Kshataja Kasa, where you have lung parenchyma involved, sometimes the bloody sputum can be seen and it can present as a Kshataja Kasa. And all of them in a later stage can end up in having a Kshata and Kshayaja Kasa. Then coming to the Vata, Pitta, Kapha, as we have discussed, there are more number of combinations available to treat the Kasa. But more importantly, if it is a very irritant cough and you feel that it is Vataja, you need to treat it with Madhura, Aushadha, Dravyas, and consider Grutapanas, and inhalations need to be given, more so Snigdha inhalations for the Snigdha Snahika Duma for these children, or the steam inhalations we can use. This this reduces the dryness and reduces the irritable cough in the child. So more so we commonly use drugs like Vibhitaki Arkapushpa with Madhugruta, Eshti Madhu, Sitapaladi Churna, Karpuradi Churna, then Dashmula Rasayanas, Haritaki Churna, Vidanga Churna in the treatment of Vatajakasa. When we move on to the Paitika Kasa, we need to have more of Saumya Dravyas because in a lot of inflammatory mediators, you have to reduce that fire, That's why you have to use more of Shita Madhura Dravyas like Draksha, Shrungyadi Churna, Sitapaladi Churna. So then Amrita Sattva, these are Godanti Bhasma, these are the things which we frequently use, and Vasa is the best drug for this. And moving on to Kafaja Kasa, so we know that it is a Ghana Snigdha Kapha. So it's the best way to clear off this is by removing it. And hence we mostly prescribe something like, mucolytic drugs or something like Vamanopaka or Vamaka Dravyas can be used in the clinical practice. So we commonly use Vachapipali Yoga or Eshti Madhu or Kantakari, Pippali. So these are some of the very importantly used drugs in the Kafaja, management of Kafaja Kasa. So never forget Trikatu and role of Trikatu in Kafaja Kasa. And of course, local Snehana Svedana, external applications on the chest would also aid in reduction of the cough. Now moving on to the Shwasa. Now, commonest chronic condition of the respiratory system. Usually, it presents as a complication of Kasa in children. Kasa Vridhya Bhavet Shwasaha. Right? So, and we know that most Kasa and Shwasa are Kaphavata predominant, Amashyasamudbhava. It is because of Adapratihata Vayuhu, Urdhvasroto Samashrita. So when the Vayu gets Avarana, it moves upward, takes the seat of Kapha and gets further complicated with the Kapha, and it comes out with a forcefully through the mouth. You call it as Kasa. When it affects the rate of movement of prana, then it presents as Shwasa. And the treatment mentioned here, Shwasa being a very acute condition, he says emergency treatment for Shwasa. So he says, Aktam Lavana Tailena Nadi Prastara Sankare. So first aim of treatment of Shwasa should be relief of the bronchospasm, chest tightness, and mucolytic action on the Gratita Kapha. So once you do this, the Srotas undergoes Mardavata, that restores the Vata, Anulomata, movement of the Vata, and the child will be relieved of that Shwasa. Now this is an emergency treatment. Once the periodicity of this treatment effect is over, the child is again going to re-get the Shwasa. And this is more so when the child has a recurrent Shwasa or when it becomes a very chronic Shwasa, and that can end up in what is called as Tamaka Shwasa status. And whenever it is superadded with the Pitta vitiation, the child can present as Pratamaka, and it can, without any trigger, the Pitta involvement, sometimes with the external triggers, it can present, and which has a more so impact with the environmental as well as the dietary changes, then you call it as Santamaka. So now, when the baby goes to this stage of Tamaka Shwasa, the baby definitely requires a thorough Shodhana, and that Shodhana is Sneha Purvaka, that is, Virechana. Otherwise, for an emergency treatment, always Sadhyavamana is mentioned. So more commonly used prescription in the clinical practice are Dashmula Katutraya Kashaya. It's one of my favorite prescriptions. Dashmula Shatyadi Kashaya, Talisadi, Vasarishta and Kanakasava, Kasturi Kalparasayanas, Shwasakutadras, Shwasakasa Chintamani. Now you see in the treatment of Shwasa, we have more of Vadi Pratinika Dravyas, because to go to the level of Shwasa, it has to be a chronic condition. Otherwise, it can be, even in Kafaja, Kasa Avastha, you have some of the Shwasa features, but that is only acute. When it happens persistently and recurrently, it ends up in Shwasa, and that time, it becomes, there is a need for Vadi Pratimika Chikitsa in a child. And this has to be followed by Rasayana Chikitsa. Now, why this again? See what happens when the child is getting recurrently ill and you have treated for the time being, the child is relieved of the symptoms, but child is not relieved of the pathology in the lower respiratory tract and the lung parenchyma. So that goes on, it requires only Vanjaka Hetu to trigger it, and that manifests as a disease. Now, there needs to be a persistent Vatanalomana, persistent Sruta Shodhana for this child, along with Agnidipana and Rasayana effect. So that is why Rasayana is very, very important at the end of the treatment of Shwasa Roga. Now, hope you are following.
Yes, ma'am. Yes, ma'am.
Yeah. Now we'll take up various clinical scenarios when a child approaches to you with a particular symptoms, how you are going to approach and how do you treat. So because, child means you can see in the picture, such a very small infant. Right, you can't think of giving 5-6 medications for this child. One target dosha, and you have to give the relief. That is being the status of pediatric practice. Now, infant with an icy breathing, you might have seen in the family as well as in your friend circle, the parents will come with, I have a very small baby, I'm very tense to the evening. As soon as the child, lies down, there is a lot of wheezing sound. And because of this, the whole night we will not be able to sleep. And we always fear something goes wrong with this child. So this is a very common in clinical practice. More so, as I said, more so while the child is sleeping. When the child remains erect in the sitting posture, when the child is active, alert, feeding well and sleeping well, you don't hear this sound. And in fact, it is a very normal phenomenon in a child. For the reason, child will have, this is called as bronchomalacia or tracheomalacia. That means the child's musculature of the trachea and bronchus are yet to develop. They have not developed, and that cartilages we have in the trachea, they fall back when the child sleeps. And because of that, when the air moves in a narrowed and the collapsed airway, so it makes a sound that appears to be a wheezing. In fact, it is not a wheezing. But no treatment is required. If I say how the parent will feel happy, they say, we know our difficulty. You are saying no problem for this child. So they will go, what? Doctor shopping to the next doctor. So you have to treat the anxiety of the parents. Now, how to treat the anxiety of the parents in this condition? You know why this condition comes? Because there is stagnation of the respiratory secretions because of the collapsed airway. So you give something which propels the secretions into, and the child swallows it. So you give a few drops, when the child is attempting to swallow it, and these effect of these medications, they continuously keep on clearing the secretions from the tract. So we commonly use Zeal kit drops for this purpose. So you can give anywhere between 7 drops to 1 ml, maybe 2 to 3 times a day, and followed by Haridra drops. Now, why this Haridra drops? Haridra drops is an immunomodulator for a child. Now, sometimes what happens if the noisy breathing is very prominent, and you can hear it as a stridor, what we do is we need to use certain tricks which increase the tone of these muscles. What we ask mother, we prescribe Kshirabala 101 drops. we tell the mother to gently massage over the tracheal region, or keep a pitchu dipped in these drops for a period of a month or so. And that period, is good enough for the musculature to undergo a bit of maturity, and they become strong enough, and automatically the noisy breathing comes down. In Kerala, there are local practices. Most of them use this kashayas, which, with a tender coconut, they boil some of the medications with a tender coconut, and that would be administered to the child. And a beautiful idea. This tender coconut contains some of the electrolytes, and you are adding some medications to it. It makes it very tasty, and it is easy for the administration to the child, right? And the local applications like, bala taila can be used, or the bala and ashwagandha powders. They can be just made a paste and applied on the local area for a few minutes, and just wash it off to improve the local strength of the musculature. Now moving on to the next scenario, where the infant is with a noisy breathing and just enjoying. Just watch a video. See, it's an infant, maybe around 4 months, visiting to the hospital. What do you see in this video? Child is having little bit of difficulty in breathing, and you see the chest portion of the child. So there is indrawing of the chest, that too in the basal area. So down area of the chest there is indrawing, and there could be some of the noises while the child is breathing. What is this diagnosis? Clinically, it is called as bronchiolitis, because there is an inflammation in the smaller bronchioles of the child. And more so, the child is not having cough here initially. You see, this is a peculiarity of the infant. Normally, when such a presentation is there, initially the older children presents with a cough, but infants usually doesn't present with a cough. They only present with a breathing difficulty. So it is more so in children of less than 1 year, and progressively they go on with a worsening cough and breathing difficulty. They may even become blue. They have a feeding difficulty. They are continuously cranky, not able to sleep. So whenever such a child visits you, always examine for 4 very important features. Make sure whether the child is having fever, count the respiratory rate, and auscultate the child, look for crackles and wheezes. If the criteria meets, then you can call this condition as bronchiolitis. You can say it as a kapha-jukasa. Then management, you see, management, you can manage this child at the OPD level. Don't feel that you can't manage, though the child is having breathing. Only criteria. If the child is breathing well, though there is a difficulty, there's no cyanosis, no fever, child is feeding well. This is very important. If the child is feeding well, your drugs will work, because all of your medications are oral prescriptions. So you start with it. So mostly it could be a viral infections in children. And so Vata Kapha Pradhana line of treatment you have to do. So Haridra drops again to improve the lung compliance. So Sitopaladi, Shrunga Basma, Abraka Basma. These are the standard prescriptions which we use, along with the Tulasi Swarasa and Pranayavani Swarasa. How to administer frequent, it in Shwasa Muhur Muhu is mentioned. How frequent? Maybe once in an hour you have to give 7 drops to 1 ml of this medication, right? And again, local fomentation and applications are very, very important to relieve the chest tightness. Sometimes when it is not possible to give all these medications, we just ask, we ask the persons to get either Sitapaladi churna or LSM powder. We ask them, take 1 spoon or 10 gram of this, put 100 ml warm boiling water and close the lid for some time, just like, Fanta Kashayas or Himas you can prepare. You can't give it as very cold. So we ask them to give it very lukewarm frequently for this child. Be careful if the child is having the inflammation, the child is having the edema, fever, then you can't give this prescription because there is already pooling of secretions and edema. So that time you need to give Shodhahara and Anulomana kind of management. Maybe instead of this, you may go in for Dashamula Fanta or infusions where that is useful to reduce this. And in such conditions, careful feeding of the baby is very, very essential because the child is having breathing difficulty. By chance, when you're feeding, child aspirates into the lungs, that is the very serious illness. So one needs to be very careful while feeding. So since all these risk factors are associated, normally no pediatrician take risk to manage these conditions at OPD level. They ask them to get admitted in the hospital. Otherwise, when to hospitalize this child? Whenever, if the child is sick looking, it presenting with a tachypnea is increased rate of respiration. So normally these infants will have respiratory rate somewhere around 40. So if the respiratory rate is more than 40, more than 50, then you call it as tachypnea. Then you have, and look for the SpO2, and if it is less than 90%, child definitely requires a supplemental oxygen and it needs a hospitalization. And if at all edema you suspected, then the inhaled corticosteroids, nebulization with adrenaline, or sometimes IV injections would be prescribed for these children. So you should know when to limit, when to refer these children for the hospital care. Now we have the clinical scenario number 3, where the infant comes with a cough and you take the history, and always do not forget to take the history of contact. Is there any family member with a similar illness, or the child was taken to travel anywhere, or the child was fed outside the home? So these all, they can contribute to the infections and the respiratory illnesses in the children. Now, once you confirm with the history, then evaluate for again 3 very important features: fever, chest signs, and feeding. If there is no fever or very mild fever, less than around 99 degrees, less than 100, then no chest signs, that is no chest indrawing, breathing difficulty, and the child is feeding well, then you can prescribe the medications to home and send the baby. Normally we give Tulasi Kantakari around 0.5 to 1 ml for such children in about 3 to 4 times a day, and golden milk with adrak, boil the milk with haldi and adrak and give to the child for feeding. Then, because this is a Kshira Annada Avastha, mother needs to be treated with Vadi Pratinika Dravyas. So for the mother, we normally give drugs like Dashmulakarutrayadi Kashaya, Amrutottara Kashaya, fever is associated, right? Or Dashmula Shatyadi Kashaya. And you can give your Shadivati to the mother. So this would, when the mother feeds, a part of this medication also reaches the baby, and the baby would be relieved. Normally, we prescribe this for 2 days or 3 days in the OPD, and we ask them to come for a follow-up. And we also explain them the worsening features. So there's no worsening of the features. They come within 3 days happily that their child is relieved of the symptoms. Next, if at all the child is presenting with a fever, then look for whether the child is active, feeding well. And always, whenever you have a history of cold, cough, fever for more than 3 to 5 days in a child, always ask for a complete blood count, ask for a CRP, right? If the complete blood count is negative, normal, CRP is negative, then again prescribe the oral medications in the form of, the combinations. Now, at this stage, we always expect the involvement of pitta equally. So you have to target almost all the tridoshas in this stage, and hence the prescription would contain both vata pitta and kaphahara medications and jwarahara medications. So normally we give either Karpuradi Churna, Situpaladi Churna, or LSM Godanti, Yashti Madhu, and Amrita Sattva. And if it is Kapha predominant, we instead of Amrita Sattva, we may add Pipali Churna also. And this prescription is for about 3 to 5 days. And if fever is there, again, Vetumaran Gulika, we normally prescribe in a child above 2 to 3 months, we do prescribe in the OPD. Vetumaran Gulika, maybe quarter to half tablet, 2 to 3 times a day, rubbed in the breast milk and given to the child. So also, Gorachanadi Gulika could also be given along with either Sahadevyadi Swarasa if it is available, or Vasa Swarasa is an excellent combination. So also Shwasananda Gulika if the child is presenting with a breathing difficulty. Now if the child is sick looking and it is having a high grade fever more than 100, and as you have taken the complete blood picture, if the total count is raised above 15,000 and CRP is positive, don't ever attempt to treat this child in the OPD. Child may anytime go into hypoxia and it may require the oxygen supply. So you have to always advise this child to be hospitalized and you have to treat it under the supervision. Sometimes, when more than 15,000, it could be a case of bacterial infection rather than the viral infection. So the child might require an antibiotic therapy. Now you see, we are excellent in treating viral drugs. I mean, viral diseases, our drugs are excellent in this. But when it comes to bacterial, it's a very fast spreading. If you don't treat this condition, the child would end up in pneumonia, which is still severe condition. So do not exercise to treat this. So either you can refer or you can admit and you call for your pediatrician and they will come and prescribe the antibiotic for a child. And that will go for about 3 to 5 days. And after that, definitely there is a higher role of our drugs for recovery of this child. So that 3 to 5 days medication is only to control the spread of infections and to see that the child is not going weak during the stage of disease. So now, as I was telling, most commonly practiced one are Sadevi Swarasa, Gorachanadi, Gulika, or Gorachana with Stanya. Then this is again a very important prescription in Aroga Kalpatruma, that is Bala, Musta, Rasna and Devadaru Churna. This is used, see, both externally, internally for the mother as well as for the baby. So you can make a Fantakashaya of this, give in few drops to the baby. The same medications you make it paste, warm it and you apply it on the chest. Okay, and you can apply the same thing as a thalam also. Okay, with some of the drugs like Shikrupatra Swarasa or Nirgundi Swarasa, based upon the dosha, you can select this. Then wipe the body. If the fever is high grade, you can use, every home has chandana. So you can ask the parents to put little bit of chandana and lukewarm water, and that jala can be used to wipe the body, especially the abdomen, especially the axillary area and the forehead. So if you keep on doing this repeatedly, you can avoid. Why this is very important? Whenever a child has a lower respiratory infection, superadded with the bacterial infection, the fever will go high grade and the child would end up in febrile fit. So to avoid this particular maneuver is very, very important. So there is a practice, we do even do talam with the Trikatu Churna, which is nothing is available. No Swarasa is possible to be get. So you will have the Trikatu Churna, you just make a paste in the warm water that can be applied. So these are the very commonly used prescriptions in the clinical practice. Now we'll take up a scenario 4. Infant with a nose block. Okay, how the infant presents always has a difficulty in feeding. So whenever the child is attempting to feed, it takes a few sucks, stops for a while, takes a breath through the mouth and then sucks. That is an important thing. No? Whenever a mother comes with a complaint, baby has a nose block, you always ask this question. If mother says, baby doesn't have any difficulty in feeding, it is normally feeding, doesn't stop in between, so the nose block is not because of the secretions, it is just because of the dryness. And the treatment changes if it is because of dryness. And if it is really because of blockage, you need to treat it like a kapha line of treatment. Now there is a noisy breathing, irritability, and you ask one more question. Whether the baby is consoled by holding it up on the shoulder or it's comfortable while sleeping. So if mother says that with the noisy breathing, if the baby is comfortable on lying down, it is because of dryness. If the mother says that no, it has to be always held up on the shoulder, then only it sleeps, then definitely there is a nose block. So this we have to have a discrimination. So if it is because of dryness, we ask them to put a drop of coconut oil or a ghee, just a plain ghee, take it in a little finger and smear it inside the nose. And this keeps the upper respiratory tract open. Dryness will be prevented and the baby will have a easy breathing. And in modern parlance, they prescribe the saline drops. What happens when you put the saline drops? This is a hypotonic solution. It draws the secretions. The mucus will be secreted in the nose and the dryness will be relieved. So one can even give some steam inhalations, okay, or saline nasal drops, as I said. Now, if it is because of blockage, then the role of thalam and the medications comes. And the best possible drug for this is Nagadali. In Malayalam and Tamil, it is called as Aruda. Aruda is the plant. Traditionally, this plant, what they do in Karnataka, every home they grow this plant in the pot. So they take a few leaves, maybe 7 or 8 leaves of this. They'll just crush it, take 1 or 2 drops of this, put it with the breast milk and give the child. And they do even take a few leaves and keep it on the scalp of the child in the topi, that is the cap of the child. So within few minutes, within 30 minutes or so, the baby would have a running nose and everything will be cleared off. So that's the importance of this particular drug. So this drug can also be, as I said, orally can be given or externally. Thalam can also be put using Rasna Churna in this drug. Rasna Chambira Thalam is a very famous practice. Everyone knows this. As I said, earlier, Rasna, Bala, Devadaru, that combination can also be used for Thalam in a child with a Kaphaja nose block. Next, coming to the clinical scenario number 6. Child with an acute runny nose and sneezes. It's very important, no? Child has an irritable 10, 20, 30 times of sneezing and there is a runny nose. A typical presentation of Pratishyaya, and it could be initially, again, viral infection, what we say is Vataja type of viral infections. Tulasi is the best antiviral drug which we have. That is why Tulasi has to be there in every home, because everybody can get this disease and Tulasi should be there. Okay, you can give Tulasi Kalpa, and it is very important to keep, because it's Vata Kapha Pradhana. Sometimes you have to keep the warmth of the child. So if you keep the child's body warm, disease will not progress. So it will not end up in having the lower respiratory infections. So that is why the best drug selected in such conditions is Kasturi. So we have a common prescription like Kasturi Gulika with that of Tulasi Kalpa or Tulasi Swarasa with the honey. Then Rajanadi Churna is again one of the very good prescription. You can give it internally, as well as the fumes you can give for the inhalation. Then Mahalakshmi Vilas Rasa. Again, I would say this is one of my favorite prescriptions. It works even better than your cetirizine prescription. Half a tablet 3 times a day for a child less than age 2, or 1 tablet TID for a child between 2 to 10 years. Excellent. 2 or 3 dose of medication, the child is off the clinical presentation of pratishyaya. And you have to complete this, continue this medication for at least 3 days, but you get the excellent results without any side effects like sedation, headache, these kind of presentations after cetirizine administration. So such a wonderful drug again. And talam, frequently we use vacha and nagatale, as I said, or tulasi rasna talam can be done, or rasna jambira talam, or nirgundi rasna talam. So these are again good practices in the clinical setting. Now moving on to the, then how long to give this medications? As I said, 3 to 5 days is good enough to relieve the symptoms. Once the initial symptoms are relieved, you have to start. Our prescription is for 3 days. We ask them to come after 3 days. Then we give follow-up the rasayana kind of medications like Dashamula rasayana kind of thing, or Agastya rasayana. So then we we ask the person to continue that medication, or simple Rajanayadi to be continued for next 1 week or 2 weeks to avoid the recurrence of the condition. Now we'll have a clinical scenario. We move on to the children now. Child with a seasonal cold and cough. This is again very common complaint. As soon as the climate changes, children come with the respiratory complaints. Again, this more of the viral complaints are prevalent whenever the season changes. So these are the typical patients to be treated with Ayurveda. They don't require antibiotic therapy. They can be very well managed with our medications. So there was a patient, 7-year-old girl with a recurrent cold cough, occasionally with fever and wheezes since 4 years. Protracted over a week. She used to get, always 1 week would be the presentation of this. Normally aggravated by exposure to cold and cold seasons are some of the freeze report. Past history, the child was hospitalized once in the last year for similar complaints. Otherwise, the child is healthy, not on any regular cough remedy. She has a good weight and height as per the age. So we, because the child, though it is a seasonal, it is Vata Kapha Pradhana, since the child has the features like breathing difficulty, wheezes, and then comparatively the bronchioles get involved in this, comparatively the lower respiratory comes. So Vata Kapha Pradhana or Kaphaja Kasa line of treatment has to be done in this particular child. So treatment is routine laboratory workup is again essential to rule out whether it is a viral or any super added infections are there. When we took the investigation of this child, the total count was 15,600 and ESR was 30, indicative of infection. And when we took the X-ray, you can see in the X-ray hyperinflations, that increased hilar prominences, increased reticular patterns suggestive of bronchitis. So this particular child had to be admitted in the hospital. We gave 5 days Shamanaushadha for this child, because the child can, we may initially start with a Vamana, but sometimes it can worsen if the child is weak. So we gave Shamanaushadha for about 5 days with Dashmalagadatraya, 10 ml 6 hourly with water and the regular combination of Churna. And warm Shunti water sips were given frequently. After 5 days, the child was induced with the Sadhyavamana, and following Sadhyavamana, the child was given Apunarbhava Rasayana in the form of Chatushashti Pipali. This Chatushashti Pipali, 250 milligram tablet, 2 tablets were given for 3 months, every day on empty stomach with 1 glass of warm milk. Now I think we did this treatment last year, and now almost 1 year, 4 months. The child is absolutely fine, And this monsoon and the last winter, the child was free of the seasonal illnesses. That says the importance of keeping Agni good and Vatanulomana in these children with these perennial presentations with the cold and cough. Now let us see just a video. So this is how we induce Sadhyavamana. Sadhyavamana, we normally use Vachapipali Yoga. And normally we get around 6 to 10 Vegas in children. They drink good enough, milk they are good enough. Estimado Fanta, initially they refuse, but once they start drinking it, they know the changes with every bout after taking Estimado. So they also finally agree to take Estimado Fanta. And the results you have seen already in the kids. We'll move on to one more scenario. A recurrent cold cough wheezes with a chest tightness, shortness of breathing in early morning hours. This is a very important presentation, and most of them are afebrile episodes. Child has a reduced appetite and it is constipated. You see all the features of what is that? Urdhva pravritti of Vata is there, and Apanadrishti is there. Then 3 episodes were there in the history in the last 6 months and triggered. Normally, 6 to 8 the respiratory illnesses in children is quite common with the viral episodes per year. But you see, in the last 6 months, the child had 3 episodes, and most of them were triggered by exposure to cold, junk, and oily food and exertion. And the child always requires a dual inhaler to relieve the problem. So the child is regularly on dual inhaler, which is on an intermittent therapy. No family history of asthma and atopy were noted. We took a chest X-ray, and there was a hyperinflation with the patchy areas of atelectasis, and there was an eosinophilia. 14 was the eosinophil counts, and absolute eosinophil counts were 1,200 on blood investigation. CRP was negative. So this is the condition I was telling earlierly, Vata Kapha Pradhana Tamaka Shvasa. And you may not call it as Tamaka Shvasa, Vata Kapha Pradhana Kasa, which can end up in having Tamaka Shvasa. But since this particular child had a recurrent episodes of same, we named it as Tamaka Shvasa only with the Pradhanata of Vayu. And we went on with the Vatanulomana line of treatment. Just see a video. This child with a severe chest retractions. You can see all the accessory muscles, intercostal muscles, diaphragm, even the sternocleidomastoids were in action for this particular child. He had a recurrent cough. You could have seen her lips were so dry. That was because the child was breathing through the mouth overnight, and so these were her investigations. You can see in the chest X-ray, you can see the hilar prominences. You can see patchy areas. There are areas where the what we say translucency of the lungs is getting affected. So haziness is seen. They are called as the patchy areas of atelectasis, and you can see the bronchovesicular, prominent bronchovesicular markings, and you can see both the diaphragm are down, indicating the hyperinflation of the chest. And these are the blood investigations. She had even the IgE, immunoglobulin E, was also higher in this particular child, indicative of this perennial allergies. So the management, as I said, in the this acute stages, though the treatment principle says give Sadhyavamana, don't. We have seen some cases, they may just go into shock, and that's a worsening condition. So we always attempt to give a soothing treatment to them first, and then take them for Sadhyavamana. Then Sadhyavamana was done, and some Sarjana Krama was advised for 2 days. Then following which the child was prescribed Sukumara Rasa, is nothing but the combination of Kumara Kalyana Rasa with some of the Vatahara Dravyas. So was given single dose for 15 days along with Agastya Haritaki Rasayana and our regular combination Talisadi Ashtin Abraka with Pipali, half teaspoon thrice a day with the honey. So after 15 days follow-up, the child was free of symptoms, and she was, regularly we asked them to come for follow-up once in a month. For last 6 months, the child was free of symptoms and inhalers were stopped. This monsoon, the child was having one episode of breathing difficulty, and recently, in the last week only, we had when Snehapana and Virechana was done. The child had 15 Vegas of Virechana. And now the child is free of symptoms and the child is on Rasayana therapy now. So now normally prescribed Rasayana is Chitraka Haritaki, because this child had a typical presentations with Agni Dushti and the Apana Dushti. So Chitraka Haritaki or Agastya Haritaki are the common prescriptions for these kind of children. Now you can see this is a report, the X-ray report of the same girl. So you can see this is before Sadhyavamana, the X-ray features, and after Sadhyavamana, you can see the most of the patchy atelectasis is cleared off. There are sparse prominent bronchiovascular markings are there, but the child's aeration in the lungs is better as compared to the previous one. This was just immediately after 1 day of Satyavamana, this particular X-ray was taken. Now moving on to the next scenario, a child with breathing difficulty. It was a 12-year-old child with a breathing difficulty which aggravates early in the morning since 1 month. The child is on Budocort and Duolin inhalers. No family history of similar complaints. Child also had a complaint of dry itchy skin since 4 years and 6 episodes of breathing difficulty in the last year. So investigations were done. X-ray increased bronchiovascular and hilar markings. CBC ESR raised, eosinophils were 8.2 and AAC was 750. So these are the details of this child. This child again was treated as Tamakashwasa, and typically why I would like to highlight this is this child is a typical case of atopic respiratory illness, Tamakashwasa. This atopy means, these children, this very, very difficult condition to manage. Their children, the typical Tamakashwasa prognosis could be seen in this. This child requires a Yapana Chikitsa. So 2 years after Dipanpachana and Virechana, Snehapana and Virechana, 2 years the child was free of symptom. Again, the child came with a history of acute exacerbation of asthma along with the dark discoloration. Now this time we did a Sadhyavamana for this child, and since the Vata Dushti Lakshanas were not too prominent, we just did a Sadhyavamana. The child is on Agastya Haritaki Rasayana now, and we have advised them to give this child Ayushvata frequently. Now in such a children, it is always important to improve the respiratory compliance and improve the nutrition of the respiratory defense mechanism. You see, the zinc is a vital nutrient which is required for the respiratory integrity. So in such conditions, again, the Kumara Kalyana Rasa works better. Or, you have Vasanta Kalpas, Madhumalini Vasanta or Laghumalini Vasanta could be prescribed for these children. And this will keep both the respiratory as well as skin integrity of the immune system. So we have a prepared medication, Shishubarna Rasa from Dutapapeshwar, excellent remedy. I tell you a few experiences. Similar, atopic tendencies, and especially in cases of urticaria. Urticaria is one such field we find most of the time. So that we don't have such a nice drug which prevents this urticaria. And by chance, when we treated, we had 3 cases of respiratory atopy with urticaria. So we happened to give them the Shishubharana for continuously for 3 months. And the children who were having everyday urticaria, now they are free of urticaria. That is the beauty of this particular rasayana. So very happy to share with you people. Then moving on to the next scenario, child with difficulty in breathing at night and hypertrophic turbiness. You can see it in the picture. This is what the presentation in the child. Then it was a 14-year-old boy, then who had a breathing difficulty, noisy breathing at night, persistent dry nose and blockage since 3 months. No history of fever, cough, or no similar family illness. So there was a bilateral turbinate hypertrophy. General examination and nutritional status was normal. So CBC was within normal limit. So we just started the child with the Indukanta Kashaya 15 ml TID with equal water, Vyoshadivati and MLV Rasa. And we did a Marshanasya for this particular child, which had been to Thaila, 8 drops for 7 days. At the end of 7 days, the child was relieved of dry nose, nose block, and noisy breathing. There was mild inflammation of the turbinates was persisting, but it was not disturbing with the child's routine. And the child was put on follow-up medication, again Chitrakaritiki Rasayana, Haridra Kanda, and Pratimarshanasya with Anuvataila. And the child is again, I think this last April we treated this child. The child is free of symptoms for last 4 months. Now, this child is with the sinusitis, 9-year-old girl with a persistent headache, heaviness in the head, reduced appetite for 2 months. Child was, she was well built and well nourished child. And there was a acute tenderness on the frontal and maxillary sinus on examination. X-ray PNS, you can see the sinuses are loaded with the secretions, indicative of sinusitis. Then it was diagnosed as Kaphajashira Shula, and the child was admitted in the hospital, and she was given Guda Arthrakanatya along with the internal medications for 7 days. The beauty of this therapy was that, you see, the child was having loss of appetite for last 2 months with the Katutraya Kashaya and Vyoshadivati and Shunti Jala. So 2nd day, the child started having appetite. Reduced heaviness was seen on 4th day. 5th day, the sinus tenderness was reduced. And the child was discharged with the Dashmula Arithikile and Vyoshadivati and Pratimarshanasya again with Anutaila, 2 drops daily. And the child is absolutely free of the features now. And in fact, the previous case which I discussed and this case were treated at the same time, 4 months ago. Now, one more very important presentation is recurrent throat pain or tonsillitis. So it will be diagnosed as Tundikeri. And this child was, the picture you see, this child had the bilateral tonsillitis. I'll show you the picture, right? Then normally, if it is not too much, it based on the grading, we do the treatment based on the grading. So OPD prescription normally is Triflagugulu Gandhaka Rasayana or Pathrinja Rasa and gargling, and show them if it is a very recurrent one, and if it is having the bad mouth breath, then swallowing difficulty, we advise Shodhana. Shodhana again is Satyavamana for these children, and sometimes Virachana. See, this was an acute case of tonsillitis. You can see here the bilateral inflamed tonsillitis. You can see the hyperemia. You can see the increased blood vessel marking on the pharynx as well as the tonsils, and even uvula for that matter. This child was induced to Sadyavamana, and you can see immediately after Sadyavamana. This was maybe after 3 or 4 hours after Sadyavamana, we took this photo, right? So such a wonderful changes we could see in this particular child. And then we just gave a regular prescription, and following the 5 days of Shamana Oshada, the child was put on Chitrakaritiki Rasayana. Again, why Chitrakaritiki Rasayana? It's all upper respiratory Amasheva Samuttavadis. So Agni Dipana Pachana and Vatana Loma is the essential line of treatment. So the child is, was under follow-up for 2 months. Now, last 2 months, the child has not visited the hospital. And we had 12 children. We did a respiratory complaints, which we had both Kafajakas as well as Tamkashwasa patients. 12 children we treated with Sadhyavamana and Chitrakarithika Rasayana. You can see the results. Highly significant results were seen in almost all the complaints which the children were brought, except for this one, one or two complaints which was not too much significant. Otherwise, it's such a wonderful remedy for children. And we know that Sadhyavamana is the best treatment for Kafaja avasthas. Then we had a case series of 32 children. We did Sadhyavamana with followed by Chatushashti Pipali, Prahari Pipali Rasayana and Kafaja Kasa children. And in fact, it's a project still going on. We have completed the clinical study. It was funded by RGHS. Excellent clinical and laboratory results we have noted. So since we are under the process of publication, I cannot expose you the complete details of the thing. And one more thing which I would like to inform is that 3 of the children who were on this project, in the last second wave, 3 of the children got COVID, of which one child was positive for the clinical features and the other 2 was positive. They had a strong contact history. And everybody in their family, they developed the clinical features, but these 2 children, though were positive, did not show any clinical presentations. Normally, if they get cold and cough, it will end up in the breathing difficulty severity. But this time, they could not go with any of such presentations. The parents were so happy to report to us that we were very scared because this child is weak and this child may die during this COVID. But for God's grace and since the child was on this Rasayana therapy, the child did not present with any of the such worsening features. This was the wordings of the parents which they came to us. And thus, the Rasayana do play a role even in the recurrent infections, like COVID also. Now, moving on to the COVID in children. Now, we know that from the second wave, it is very alarming for children. Last second episode, we have thousands of children being affected, and we did lose many of the children with this second wave. And now we are all expecting the third wave, and the speculation says that it may worstly hit children. And to be frank, it may not be so with the children because children have their typical immunity and they have a better recovery rate as compared to the adults, okay, with regards to the viral infections. But nevertheless, 5 to 10% might require ICU care. So impact on pregnancy and fetuses are yet to be clear, no say. But only thing what I can share is we had about 4 to 5 deliveries where the mother was COVID positive in the last event. All the babies who born were IUGR. They were normally growing, but at term they remained to be IUGR post-COVID. That means the mother was worstly hit with the Agni Dushti. So we did had a few experiences. After knowing this, another 2 cases, we did Agni Chikitsa for the mother. And children came up to the borderline 2.5 to 2.6 was the weight. That much weight the child could gain later. And there was one child which, though it was diagnosed COVID, but we could not give any Ayurveda medications for them. And the child ultimately, the child had to be kept in NICU and it was scared. Of course, the child recovered, but still the child had presented with the hypoxic events following the delivery. Now we have a standard Ayush guidelines. I think I will not discuss much on the Ayush guidelines because everything is given as a chart. Everybody can just go through it. The general guidelines will be the same for children as well as adults. That is SMS, social distancing, mask, sanitization. Here, not only for the child, even for all the family members is very essential to prevent excessive spread of this to the children. Now, only key guidelines to every parent is that as soon as you come from outside, don't go to the child directly. You have to wash yourself cleanly, change your clothes, wear a mask and be with the child. That's the best way to prevent the spread of COVID to the children. And immunizing the young parents is essential, because if the parents get the illness, they can easily transmit it to the children. So if the parents are immunized, their features could be very less, and hence the less chances of it getting transmitted to the children are there. So this care one need to take. And this is what is the severity guidelines issued by the Government of India. Based upon the presentations, we can just classify them, and again see whether it is COVID or anything. So please classify this, which dosha predominant. So mostly COVID. In the second illness and the first event, it was kapha and vata pradhana presentations were more, while Pythika was less. Now the third wave, this delta plus or delta presentations are there. No, they are Pythika in nature. They are very fast spreading. So maybe little bit modifications in the management. We were giving high emphasis on the use of Dashmula Shatyadi, Dashmula Kashaya, Dashmula Vitraya, Amrutattara Kashaya, Guruchadi Vati. So previously, maybe we have to have a shift. We have to go like, Mas Darshan Kada, Sudshekara Rasa, along with, of course, the use of Dashmula and this one, Guru Chiganavati, in the management of current impending wave, what we are thinking, Delta Plus, that could be very severe and fast spreading. And again, so far, one thing has to be kept in mind, that is, so whenever you suspect a child with upper respiratory illness, especially in this situation now, from now onwards, child gets a cold, runny nose, fever. First day, we usually used to say, wait for 1 day, continue with these medications. If the child doesn't recover, child has a sick look, poor feeding and all, immediately has to be taken for medical attention. Now, please treat every child who comes with such presentation as COVID only. If the next day the child is safe, child is not having any deterioration, continue with the regular this one. Always SpO2 monitor is very essential. Any child with the falling SpO2 less than 94 or 92 in the room air, better to be admitted in the hospital, because child ICU treatment is totally different as compared to the adult ICU. So before going to the ICU level, the child has to be admitted, and it has to be started at the ward level only, the treatment. So that is the very key message for everyone. So SpO2 monitoring is very important for children. Look for the sickness, look for the feeding difficulty. If the child is sick, not liking to feed well, that is indicative of a severe disease progression in a child. So now, just two preparations for you, which could be useful during the COVID presentations. That is a golden latte, that is golden milk. How to prepare golden milk for children. Boil the milk, add 1/2 to 1 spoon of haritra powder. Always best you prepare haritra powder at your home. Can put little bit of dalchini, elam, or a bit of pepper also is ideal, or adrak also can be put. So just mix with, boil this. This could be filtered, and after filtering it and removing it from the fire, please add little bit of honey and then feed the child. It's very tasty. Children would love to drink this. And the consistency would also be good. And you can garnish this with a few powder of almond. You can garnish. And there's one more lavangadi paniyam. Tulsi, ginger, twak, patra, cardamom, pepper. So boil, and you can reduce it to half. Actually, Ayurveda mentions for children you have to reduce it to 1/8 and give, but at least half is fine. So add a bit of honey and a few drops of nimbu swarasa would be ideal for administration. It will taste good so that the children will accept it better. And finally, conclusion, respiratory diseases are very common in pediatric practice. Diet, avoid excess fried junk and chocolates, because they are the culprits which initiate the upper respiratory infections or the disease process. The habits of brushing twice in a day, playing and breathing exercises are very, very important, especially in this ongoing pandemic. At least 20 to 30 minutes play for a child. Don't lock them at home. If you're locking them at home, you play with them. You can ask them to do a skipping or take them outside a nearby home, play them, make them run, jump, or go to the park. And of course, you have to follow some rules of sanitization, mask and all. Then you can teach them some pranayama techniques. If not pranayama, you can give some blowing objects like balloons, mouth organs, something, they keep on blowing every day at least 20-30 times, and that improves the lung compliance in the children. Then household immune boosting preparations, as I've described earlier. Then keep the home clean. That is also very important, because any general illness could trigger and could mimic COVID, and the child has to end up in COVID hospital and super added infections. So try to avoid these things. And then Ayurveda can offer wide range of effective therapy for childhood respiratory illnesses, provided if you are keen at identifying the worsening symptoms. Please identify the worsening symptoms. Don't hesitate to refer the child at the right time. If you do that, then you will be a successful practitioner. With this, I would conclude. I hope this particular lecture could be useful to you, and I have not bored any one of you. Once again, I would like to thank the whole management team and the team Kaumarabhrithya for giving me this wonderful opportunity. Thank you so much.
Thank you, ma'am. That was one good informative session. That marks the end of the session. Let's take some time for the questions now. Hereby, the participants are requested to type their questions in the chat box. Ma'am, there are some questions in the chat box, ma'am.
Please go ahead.
Ma'am, if a child with low appetite and not gaining weight with no abnormalities can be taken as?
So you can treat it as karsha. Karsha because the child eating well but not gaining weight. Okay. with a mild of Agni Dushti. So treat it as Kasha. Only treatment required is Agni Dipana. Don't give any supplementations, not required. So Chitrakadivati, we normally give Chitrakadivati for about a week's time. The child would have a better appetite. At the same time, please look for the presence of Krimi Dushti in the child. So if you suspect a Krimi Dushti, so you can even start with something like, Bunimbadikada or, Krimi Shodhini Gutika or Krimignavati, maybe for 3 to 5 days along with the Chitrakadivati. So that is good enough to improve the appetite. Once the child's intake is better, he would definitely gain the weight.
Ma'am, can you suggest best medicine to prevent COVID for children?
Best medicine to prevent COVID for children. Give something which is very good Agni Dipana and Pachana. That prevents the chances of infection. And the child's all Dipana Pachana dravas are in the form of rasayanas. All rasayanas are Dipana Pachana, in fact. So if the child is, there's a lot of practices. Even in Tamil Nadu, you have this Urai Madurai, right? Uramaranu practices. They are ideal, in fact. So you can just give a child this Uramaranu maybe for 10 days or a month. And later you can just give alternate days or 4 days a week and continue for a period of 2 to 3 months. That keeps the child free of susceptibility to develop the viral infections. At the same time, these viral infections are worse when the child is having Apana Dushti, or anybody for that matter, even adult. So see that Apana Dushti is not there in the child. So Uramaranu is good enough to take care of this. And if you ask me any rasayana, you can give anything like Chavanaprasha rasayana for children. It is easy to take. Or else what we are doing in our hospital, I tell you, we have a kit for a month. So we have one gold preparation, which is again Kumara Kalyanaka Rasa. We prescribe this 10 days in a month for children. And next 20 days, we give them Uramaranu or Balagrahavati or something like Chatushashti Pipali. Then we give them to take Kashaya every day, this Haridra Kanda or Kashaya every day. And that is enough as a medication. And compulsory, our prescription includes 20 to 30 minutes play for children every day. So that is good enough. And any child who has had a history of recurrent respiratory illnesses, we ask the mother to put a drop of coconut oil and just smear inside the nose every day when the child goes for sleep. This is what we are doing. And there are people who are prescribing this Swarna Kalpas, Swarna Prashana. Daily Swarna Prashana is again one of the ideal measure. So where Swarna Prashana also contains gold as well as the Panapachana Aushadas, and any Grutas you can use which are Srota Shodhana in nature. You can use something like Shatpala Gruta or Indukanta Gruta, prepare Swarna Prashana, and that can be given to the child.
Ma'am, can we use Gouda instead of honey in golden latte?
Gouda, yes, you can use, but if you put Gouda, don't boil it. When you put Ardrak and Gouda and you boil, it gets split. So you have to remove it from the fire and then add the Gouda. It can be used. If it is for taste, honey is, Gouda is good. And if you want it for Kapha Vila, always honey is better.
Ma'am, what can be done in laryngomalacia?
I've already explained while dealing with the case. Laryngomalacia and tracheomalacia. So you can advise a local massage or pichu, And internally, any some of the drops like Zeal Kit drops or Haridra drops, they are good enough.
Ma'am, there are no other questions, ma'am.
Ma'am, good evening, ma'am.
Good evening.
Yeah, I'm Dr. Kritika, madam.
Yes, ma'am. Yes.
Actually, ma'am, one such case, child, I think he's 7 years. He is having, he used to have recurrent discharge in the ears, actually.
Okay.
So once I told him to do Duma with this Kantakari, that yellow color, smaller one with thorns, that yellow Kantakari, it has been it dried one, and it is given Duma in the ears, and actually the discharge stopped. But after few days again he used to get, and the history, he used to swim in a small tank regularly, but even
Okay.
if he stopped that regular practice of swimming, he used to get that discharge. We gave Vyagradi Kashayam, and but still it is not completely he has not completely recovered.
Okay, ma'am, you, as you said, no, rightly, you treat him with Vagradi Kashaya or Dashmula Shatyadi Kashaya or Vyoshadivati initially. Duma is good to relieve the acute ear discharge. And here the infection may not be in the ear. His the infection will be subnormal, that is dormant in his throat area. So whenever he gets exposed to the such situations, once again it flares up, and it has a ear discharge also with the sore throat and other manifestations. So Sadhyavamana, if you can do, is ideal one. If not, you can just go ahead with the Shamanoshana as you mentioned. Please, after that, you put him on a nice rasayana, if possible, with a gold rasayana, gold containing rasayana, maybe like Kumara Kalyana Rasa or Swarna Muktadi Gulika, for maybe for a period of 1 month, ma'am. He will have excellent results with that.
Okay, ma'am. As you said, we were regularly actually prescribing Vyagradi and Yoshadi Vatakam only. But he used to get that condition recurrently. So that's why I had a question that any other
Just give us Swarna Kalpa, ma'am. He will be out of this.
Kalyana. Okay, ma'am.
Yes. Yeah.
Thank you. Thank you.
Ma'am, can we continue Swarna Prashan for child monthly once?
Monthly ones, of course you can give. If you are keeping your child, Agni proper daily, monthly one Swarna Prashana is good enough, because the dose we give in monthly one Swarna Prashana is totally different from daily Swarna Prashana. So that in that dose we can definitely continue. And we had 4 studies where monthly Swarna Prashana was assessed, and we have seen that the recurrent GIT illnesses as well as recurrent upper respiratory infections, this was a 9-month study. We followed up children for a minimum of 9 months in a whole year, and we documented that there was more than 50% reduction of these illnesses when the child was put on monthly Swarna Prashana. So definitely even monthly Swarna Prashana has its role. So we can give.
Ma'am, there is another question, ma'am. Any aushadhi for the excavation of allergic rhinitis during this monsoon season?
Exacerbation of, okay, right. You can treat it with Vyoshadivati, then give Dashamula Kashaya, the steam inhalations you can give. Haridra Kanda is the best medications. And if you want an acute control, Vilvadi Gutika, or you can go with Rhinagra capsules or Nasolerin capsules. maybe 3 to 5 days continuously. Then after that, continue with Vyoshadi Vataka and Haridra Khanda. That is my idea.
Thank you, ma'am, for your valuable response. And I thank everyone for the positive interaction. A positive thinking is not only expecting the best to happen, but it is also about accepting whatever happens is for the best. The greatest leader is not necessarily the one who does the greatest things. He is one that gets the people to do the greatest. I would like to call Dr. Amal Babu, Associate Professor, Department of Kaumarabhrithya, to deliver the vote of thanks.
Good evening, one and all. A happy Independence Day to all. So, on behalf of Nandha Ayurveda Medical College and Hospital, I would like to express my sincere gratitude to Chief Patrons Thiru V. Shanmugam, Chairman, Sri Nandha Educational Trust, Sri S. Nandakumar Pradeep, Secretary, Sri Nandha Educational Trust, Sri S. Tirumurthy, Secretary, Nandha Educational Institutions for their constant support. And I would like to thank today's guest speaker, Dr. Reena Kulkarni, Madam, Professor and HOD, Department of Kaumarabhrithya, SDM Institute of Ayurveda and Hospital for the enlightening sections. We thank you on the behalf of Department of Kaumarabhrithya and Nandha Ayurveda Medical College and Hospital. And I express my sincere gratitude to our principal, Dr. M. Kritika, Madam, for the constant support and guidance in conducting the program. Thank you, Madam. I also thank Apollo James, sir, Administrative Officer, Nandha Indian Medical Campus, for all the support. I also thank all the teaching and non-teaching staff of Nandha Ayurveda Medical College and Hospital for their support and participation. Finally, I sincerely thank all the participants for their patient listening and active participation. Thank you, one and all.
Thank you, sir. The greatest force in the human body is the natural drive of the body to heal itself, but that force is not independent of the belief system. Everything begins with belief. What we believe is the most powerful option. With the divine blessings, let's end the session with Shanti Mantram.
सर्वे भवन्तु सुखिनः सर्वे सन्तु निरामयाः सर्वे भद्राणि पश्यन्तु मा कश्चित् दुःखभाग् भवेत् ॐ शान्ति शान्ति शान्तिः.
Now, this is not the end. It's not even the beginning of the end, but it is perhaps the end of the beginning. We'll see you soon with another interesting topic. Until then, signing off from Tejashree, Rashweta, and AYUR NANDAN team. We wish everyone a safe and healthy weekend. Thank you.
Thank you.
Thank you, ma'am.
Thank you, ma'am.